Hi, Jeffrey.
Now, I'm not computer savvy, and even this is above. I had difficulty with this. I'm on my iPhone right now, so that's the best I can do.
Yeah, no worries. We can see and hear you. You hear me fine?
Pardon me?
You hear me fine?
Yeah, I hear you fine. I'm just on my cell phone because I can't get it on my computer right now.
All right, strange. Well, no worries. You managed to get here.
All right.
So we've already had a lot of people in the chat box. Dave Lee and Dr. Keith Nichols already said hello. So glad to have you watching us, guys. Thank you.
All right, good. Let's carry on then.
All right, so we've opened the chat box on the screen as well. So let me read out some questions for you. I already know a lot of answers you're going to give, but anyway, some questions keep on coming back. How do you feel about long-term usage of low-dose Nandrolone, 50 milligrams per week, alongside your or my current TRT protocol of 175 milligrams per week?
How do I personally feel about that?
Yeah.
I was on that I was on low dose Nandrolone for over 20 years unopposed. I had no complications other than feeling wonderful. Now, again, in my current practice, I don't have a whole lot of guys on Nandrolone. I only have a half dozen that I've added it to their program because they've told me it helps them and they feel good on it. But again, it's always a 2-to-1 ratio. And a lot of guys, they want the higher, 150, 200, 300 mgs of Nandrolone. I said, that's not testosterone replacement therapy. So I tend to stay away from it but I only partake in it for men that have had good results, have been on it before, but it's always in low dose. But my experiences and with the fraction of men that I have on it, not a one has given me any complaints about it.
All right. Another question there. How high should you go with your total testosterone to optimize free T? The guy that asks says my total is 1000 SHBG 75 and free 125 picograms per milliliter.
Well, remember, this is not a laboratory science. It's a clinical science. Meaning, I don't care how high your total testosterone goes, especially with an SHBG of 75. I'm gonna have to take that total testosterone pretty high to get the free testosterone where they feel good. And again, I go by how they feel. Now, obviously, I know I'm not gonna take a guy to 1,000 milligrams a week of testosterone to make them feel better. But my point is, I'm looking at the numbers, matching it with the symptom resolution. So I'm looking at free testosterone. We both know that free testosterone, according to Terry Hertog, has to be above 25 to be optimized. And most of my guys feel better between 35 and 50 free testosterone.
Yeah. That are the typical ranges people feel their best, right?
Yeah, I think we did. I think Danny Bosa asked some years ago, how many of you guys, what's your free testosterone ranges for where you feel optimized? And I think the vast majority of the people reported said that they felt better 35 to 50, so 30, 35, 47, 48. Me personally, I feel better between 45 and 50 on my free testosterone. That's where I feel optimized.
Hi, can I get rid of my cholesterol pill every day when on TRT? It's all a very general question, of course. I already stopped it by diet and sport, but I'm not sure.
Yeah, of course you can get off a synthetic chemical. You don't need to be on that gosh darn statin. Statins are the biggest scam ever perpetrated on the American population, other than Brand Covidians and the Covidians out there. No, but really, the answer to that question is, yeah, you can stop the cholesterol medicine. I mean, you need cholesterol. You go round and around, the big cholesterol scam,
Yeah. Yeah, it's quite a myth here still in our in our society as well, that your cholesterol has to be under a certain limit, and they're lowering that limit almost every year. So
well, Stephen, we know why they do that, because they have a drug that lowers your cholesterol, but still the mortality, the M&M mortality and morbidity hasn't gone down. So you die of the same causes, just with a lower cholesterol. Big deal.
all right. What are your thoughts for men over 60 being on Oxandrolone 4% cream, equivalent to 20 milligrams oral, for strength and all other benefits?
I don't have any clinical experience with Oxandrolone cream, so I really can't speak to that question.
Mm-hmm.
So,
and for the oral version, what's your opinion for men over 60?
no, I think Oxandrolone, that's Anavar, correct?
Yeah.
You know, when I entered this realm 54 years ago, Oxandrolone was not even talked about in the male population. It was something that only women, were interested in. So, again, I have no men in my clinical practice on Oxandrolone, but if they were to be on it, I would definitely recommend oral in lieu of in transdermal, because I have zero clinical experience with transdermal Oxandrolone.
Mm-hmm. I didn't even know it existed, transdermal Oxandrolone.
I didn't know either, but I guess you can have a compounder make it for you.
Yeah, probably. Yeah, let me have a look. Someone says, I've been on TRT for 2 years now, 44 years old, 165 pounds, 5'7", live 3 to 4 times a week, clean diet, good sleep, 50 milligrams every other day, and very little to no symptom relief. All my levels on paper are good. What can I do to optimize?
Stop poking at your level. Stop looking at lab values. This is not done in a vacuum. I mean, when you're on testosterone, you need to optimize vitamin C, vitamin E, zinc, vitamin D with K2. You need L-carnitine. You need a high potency B complex, magnesium. You need a lot of things that have to be in your system at optimum levels to get the best results you seek for TRT. So again, it's like putting ethyl fuel in your Lamborghini, but not changing spark plugs. You can do all the testosterone you want to, but if you're not giving your body the coenzymes, cofactors, vitamins, and minerals it needs to perform adequately or optimally, you're not going to feel much different. I always look at from an orthomolecular perspective how I can optimize the internal milieu.
Mm-hmm. I had another question before. Yeah, someone said or asked, I want to switch from test E to test undecanoate. I hope the longer ester will allow me to aromatize less and to have more stable blood levels. I plan to do 1 injection per week instead of 3 I currently do on test E. What are your thoughts?
I don't have any experience with undecanoate, the injections. I have some patients that are on oral 40 milligram testosterone undecanoate little capsules, little gel caps, and they'll pop one of those prior to a workout, and they feel like it gives them a little more oomph to get through that workout. So, but I think it would make sense that the undecanoate would be a good way to go for some people that don't like it. Me in particular, this patient I'm thinking about gets his undecanoate from overseas, from India. So I don't know what he's getting. But the bottom line is, I don't have any clinical experience with measuring men's testosterone levels once they're on decanoate.
Mm-hmm. But it makes sense, right, to do less injections?
Yeah, what you said makes sense to me. It makes sense logically. I just can't speak to it clinically right now.
You do still recommend tadalafil for all your men on TRT, Jeffrey?
Yes, I do. I recommend low-dose tadalafil for every human being, whether it be male or female.
All right, because I recently had a comment under one of our tadalafil videos, and the comment was, these guys need to be honest for once and admit that they recommend tadalafil to open up your veins and arteries to move all that thickened blood from TRT.
Well, yeah, we all know that the PDE5Is don't just work for at the penile level to open up vasculature, but it works around the body, systemically. So exactly, yeah. So I recommend it for every low dose. If any human being, male or female, can afford to be on low dose tadalafil, I strongly recommend it.
Mm-hmm. Do you already also recommend it to protect the prostate from benign hypertrophy?
Well, I know. Yeah, I do, because my urologists and my urology friends have recommended it, because it's been approved by the American Urological Association, I believe, as a method of treatment for BPH, and in particular to help prevent the progression of BPH. So yeah, I think it's a tremendous medication for men in particular, but like I said, I also recommend for women. Obviously, they don't have prostates. But my point is, yes, it's a great medicine in low dose. Now, again, I tell a lot of my guys, if you can't afford tadalafil low dose, just dose arginine. I mean, you can get some arginine. I recommend 500 milligrams three to four times a day. Some got, just to get a good baseline vasodilation and do the arginine. I mean, I've recommended arginine years ago, 40 years ago, for guys who had minor ED issues, young guys. I said, well, let's not put you on a PDE5I yet. Let's put you on some arginine. And I'll be darned if they come in and say, Doc, that works great. I don't know if it's placebo effect, but they're saying, yeah, it's wonderful. But personally, right now, I'm on low dose arginine. Or I take 500 milligrams every couple hours through the day, because I just feel it opens up my vasculature. And of course, before I go to the gym, I load up with niacin, the flush type, with arginine, to get a good, I guess, pump, because my vessels open up and I feel much more alive. Not only that, but it kind of wakes me up in the morning too. Get that little prickly sensation through your skin before it wears off. But yeah, I've been using that regimen pre-workout for 54 years.
Awesome. And what about for the same purpose, maybe low dose aspirin?
Yeah, that's one therapy that goes up and down as far as in literature. Sometimes you read an article that says, you don't want to be on it, you run the risk of bleeds. But most recently, the literature I've read seems to tout it for its therapeutic benefit. So yeah, I recommend 81 milligram enteric coated aspirin for pretty much everybody now.
Awesome. There was another question there. Is there really any difference between taking testosterone cream at 20% at 4 clicks in the morning versus 2 clicks twice a day? Doesn't taking it once only in the morning stimulate what your body naturally makes?
Well, again, that's the kind of thing where I tell my patients, it depends on you. If you feel like you take it in the morning, and by the late afternoon, early evening, you're waning, and I said, then divide it up into morning and night, and tell me how you feel. And most of them will give me that history, tell me that when they did divide the doses up, they feel much better. But there's been a few people that tell me they feel better on the once a day dosing. So I experiment with it. Just play with it, give me the feedback, and let's go with it.
Mhm. Gus in the chat box says he's triggered because you said women don't have a prostate.
Oh yeah, yeah. Sorry, I don't mean to offend anybody. Biological men.
All right. Yeah, we must pay attention to all
Yeah.
that wokeness.
Right.
Yeah, someone says it makes sense. I would believe as your testosterone drops at the end of the day, doing the extra cream then is better.
Yeah. Yeah. Again, I've got just as many men who prefer the daily application that do prefer the twice a day application.
Yeah,
It's individualized. That's all.
Mm-hmm.
Because some people, believe it or not, they get on that second dose, that late afternoon dose with the testosterone, and they can't. They have more difficulty sleeping at night.
Yeah.
So I tell them, well, then don't do it at night. You know, just you're a kind of guy that does it once a day. Or if you do it twice a day, make sure your second dose is in the early afternoon. Don't do it at night.
All right. So Mike Lindner says, hello, Dr. Ruterbusch. I see Simon there. Hello, Simon. A lot of questions. Another thing I wanted to ask you, Jeffrey, maybe you have seen a couple of videos I did with Dr. Rudolf Eberwein. He talked about high ferritin levels. We have talked about that in the past as well. And he said this might be an indication to do blood donations after all when your ferritin is too high, and that because of longevity reasons. What are your thoughts on that?
Yeah, ferritin, believe it or not, there's optimum levels of ferritin that you need to be above for your thyroid to be working properly. Believe it or not, it's got to be above 90 for thyroid optimization. Now, that's both in my practice and what I've read in the literature. Now, I obviously, I don't think I think you don't want that to be much higher than 110 or 120. I think maybe 150, but definitely got to be above 90 to optimize other bodily functions. But yeah, obviously ferritin, if it's too high, you gotta dump iron, dumping iron. You know, not pumping iron, but dumping iron.
Yeah. Is that something you see in your practice that men's ferritin is getting higher and higher while getting older?
Yeah, I tend to. I don't think there's a direct linear correlation between men's age and their ferritin, but obviously, I think the aging process, in particular, the body's less efficient at iron turnover. So I tell my men, listen. One of the reasons it's thought that women live longer than men is because when they're younger, they have menses and they're dumping iron on a monthly basis, which is a pro-oxidant if it gets out of hand. So I tell men as an anti-aging therapeutic, it's not a bad idea to donate blood on a regular basis. But then again, you don't want to crush your ferritin either. So I make sure it's above 90.
Okay. There's a question about scar tissue. Some people develop over the years scar tissue because of all the injection. Is that something we should worry about?
Well, there's a guy that's been in this business for 54 years and seen the results of people who've done weekly injections into their glutes. Yeah, I think it is an issue. Obviously, the longer you're on this stuff, but I don't think for the majority of men who get on it at in their 40s and 50s should really worry about it. But then I tell them, if you're worried about long-term scar tissue, well then just change the needle size out, go more frequently with the injection with a smaller needle gauge, or sometimes just like Dr. Chrisler told me, God rest his soul, sub-Q aliquots of small portions of testosterone is a way to go without going IM and getting scar tissue. But I told people before, when I was first looked at people's buttocks who were on several years, 10, 15 years of testosterone pellets, Man, those guys' buttocks are like styrofoam. They're so scarred down.
Yes, for sure. Do you see similar or comparable results with sub-Q injections?
Yes, I do. I just think it's because if it's a slow release, it's a more steady release. I think men get used to the more instant release going IM than the sub Q release. So I think it's more psychological that they prefer the IM. But I have had just as many men who have stuck with the sub Q, and as I measure their blood levels that have stabilized, they're happy with the sub Q. So yeah, as John Chrysler stated, he was very big on sub Q injections.
Mm-hmm. In your practice, do you see a lot of younger men or middle-aged and older men getting on TRT? And is that evolving over the years, more and more younger men? Maybe?
Yeah. That's a good point, Steve. That's a good question. But over the years, when I first got into this business, it was just older men primarily. But I am seeing younger and younger and younger men now. Is that because the word's out and people say, I want to get on testosterone because, it's more frequently conversed out there in the civilian in the world, or because we know that men's testosterone levels are coming down slowly over the years because of the xenoestrogens, the pollutants in our environment. And there's a thing called testosterone resistance syndrome, TRS, that you can look into. But there are some men that just get a testosterone resistance syndrome, and they need it earlier than the men that don't. Obviously, I've seen more cryptorchids too that are coming in my practice, both unilateral and bilateral cryptorchids that for some reason I'm seeing more and more of them, and I'm getting them on testosterone at earlier ages.
Mm-hmm. Another question from Simon. He says, are there any benefits of donating blood? We know we don't have to do it for TRT reasons or high estrogen or high hematocrit.
Right.
We know, but just donating blood. Are there any beneficial effects you can mention?
Well, yeah, I mentioned in fact dumping iron is good because as we know, iron is a pro-oxidant. It's a good way to dump some of the old iron, and the body had to regenerate some newer, fresher iron. But I just tell people it's predominantly for the service to your community, because it's I think it's beneficial to dump iron on occasion, but definitely it's good for to community service, especially as more and more of our blood supplies are dwindling, and since the non-vaccinated blood is more and more sought after now because now it's not tainted with the with spike protein.
Mm-hmm.
Yeah.
So in your practice, Jeffrey, how do you go about starting men on TRT? Do you start them up on all the hormones at once? Thyroid, testosterone, DHEA, pregnanolone, because maybe you want to get the benefits from all the hormones? Or do you do that step by step?
I use a step-by-step approach. I just don't like putting so many hormones on at once, because if a person feels good, I'm not quite sure what the culprit was, or what the hormone was that made them feel better. If they feel worse, I'm not sure what the culprit is. So I prefer having that man feel one hormone at a time. That's why I tell my guys, listen, this is not an overnight fix. You're going to enter into a contract with me that we're going to work this slowly. It could take an hour, could take a year to get you totally dialed in. So be patient. So they know up front.
But once dialed in on the testosterone and the man feels better, do you still try to optimize thyroid as well, even if all the laboratory levels are okay?
Yeah, well, let me tell you something about thyroid that I'm finding out. If I got a guy, and this is common, I'm finding out, libido is so complicated. I have a lot of guys that, they get a little bump in the libido and then they flatten out and say, man, my libido is back to square one. I'm on my testosterone. So my research on thyroid hormone here recently, I found out that if you got a guy that, or even a woman, their libido is kind of not very good anymore, and put them on a trial of thyroid hormone. And believe it or not, I look for a TSH of 0.8 to 1.8. Once you get above 2 on TSH, I'm very suspicious that you need thyroid support. By the way, what's the problem? What's the problem with just trying somebody on low dose thyroid? Start them slow, like 30 milligrams for a week. And if they feel better, great. I said, go and then go up little by little. But yeah, so I have no problem with starting somebody on low dose thyroid if their libido is not optimized. And believe it or not, I'm finding that thyroid optimization or thyroid hormone, in addition to the TOT or testosterone optimization therapy, has been very beneficial for regaining sex drive in my human beings, both men and women.
And what about DHEA and pregnanolone? Are you putting most of your men on those as well in the later step in the process?
Yeah, there's doctors who train me that say that everybody should be on pregnanolone because there's no real downside to it, no real serious side effects, and they recommend start everybody on 100 milligrams a day of pregnanolone. If it's oral, of course, you can put it on a cream application. But I tend to use DHEA first and optimize that. And that's a unisex. That's like a unisex hormone where I just find that the majority of humans feel better at 350 to 500 when it comes to their DHEA sulfate. The levels of pregnanolone I found that works best for men is 180, and just for some reason I gotta give women a little above 200 to make them dialed in. But pregnanolone, I usually wait till I usually put it on, at least in my practice. The second hormone I put somebody on is DHEA usually. The third would be pregnanolone, trial of pregnanolone. I don't put somebody on thyroid unless they really, 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 come in there. They have low thyroid symptomatology, or like I just told you, I got them all dialed in, I think, but their sex drive isn't there. So then I'll give a little trial of thyroid hormone, especially if the TSH is above 2.
So we talked about testosterone, thyroid, DHEA, pregnenolone, and then we still have two other hormones, vitamin D and melatonin. And I know you're a big proponent of using high doses of both, aren't you?
What, vitamin D?
Vitamin D and melatonin, yeah.
Yeah, I'm big on the anti-carcinogenic anti-cancer effects of melatonin. We've done a broadcast on this.
Yeah.
Where it got to be above 20 milligrams a day to get the nuclear factor kappa, and nuclear factor. I can't remember, but that's the one that I get under control by high dose vitamin D. But it's got to be with K2, of course. You know that vitamin D3 with K2, and that's important. We know that it's got to be with K2, otherwise that calcium can be driven into soft tissues, not bones and teeth where it belongs. But vitamin D, as you know, is not a vitamin, it's a pro-hormone. I'm very, very big on it. It's the most powerful immune modulator God has given us.
Yeah. And the melatonin, 20 milligrams or above, to have the antioxidant and anti-cancer effects.
Yep.
Right.
I'm a big proponent of melatonin. I think it's a tremendous supplement.
Mhm. Yeah, we talked about that recently with Dr. Keith Nichols as well. I thought I heard him say he's taking 600 milligrams per day.
Well, I think Keith was telling me, or at least I heard years ago, he was like 45, 90 milligrams a day. And of course, that we thought that was high back in the day. But there was a guy that told me he buys the melatonin in bulk from Bulk Supply, and he gets in the powdered, big old bags of powdered melatonin. Let me tell you something. He said he puts it in capsules. He buys capsules and puts it in the powder in the capsule to get it down because it's very bitter. And I bought some a few months back. I got a big old bag of that stuff, and that stuff's the nastiest tasting powder on the planet. So you gotta get that in the back of your mouth and chug it down with something. But yeah, that's how I take a half a teaspoon of powdered melatonin every night. I'm probably getting over 100 milligrams right there with the bulk supply.
Mm. Yeah, not gonna try that. I have capsules of 20 milligrams, and I take 2 at night, so 40 milligrams. I think that's enough.
Yeah, and remember that the vitamin K2 got to be with MK4 and MK7 in particular. It should be at least 180 micrograms.
Yeah. I had another question somewhere. Yeah, what's your stance on using enclomiphene, maybe for younger guys that need TRT?
You know, I've seen a lot of advertisements now coming across my Facebook feed, different companies advertising that they'll start a man on enclomiphene with their testosterone therapy. I'm not a big proponent of it. I tend not to. But if a guy comes in and told me he felt great on enclomiphene, he's been on it, I said, well, let's not reinvent the wheel. I can write it for you. But I tend not to use that in my practice.
Mm-hmm. Do you use telmisartan for men, maybe preventively on TRT?
No, I don't use it preventively.
Mm-hmm.
But if a guy comes in and tells me that he's having BP issues, and then I said, what have you used in the past that's helped you? Because I don't manage blood pressure issues. I'm not a primary care doc anymore. But I'll say, telmisartan, doc, telmisartan. So I said, okay, well, I'll write that for you since it's working for you.
Mm-hmm.
But I personally feel that if you get your potassium and sodium ratio ideal, like 1-to-1, like it was in the old days, versus 20-to-1 sodium to potassium these days, your blood pressure will normalize.
Mm-hmm.
You
Yeah,
got to
sure.
eat right. You got to get your sodium down, your potassium up, and keep your salt intake low. Unless it's Celtic sea salt or pink Himalayan sea salt, which then you can salt to taste. That not only has sodium chloride, but it has the other 92 minerals that come from the sea. So back to that question, I tend to just tell people increase your potassium intake significantly.
Mm-hmm. What are your thoughts about taking high dose taurine, around 6 milligrams twice a day for health benefits?
Now, I didn't catch a toluene.
Taurine.
Oh,
T-A,
taurine. Taurine.
yeah,
Taurine.
exactly.
Yeah. Well, that's a substance that's in a lot of these drinks now. These
Yeah,
power drinks, protein drinks, not protein, energy drinks.
yeah.
So yeah, I mean, I've I've never prescribed it, but some people swear by it. I know it has anxiolytic effects. It can
Mm-hmm.
be somewhat calming. So yeah, it's out there, but like I say, I do not frequently talk about it to my patients unless they bring it up to me, and I'll say, well, let's talk about that. But yeah, I just find it's in many of these energy drinks now. It's got torque, but then again, what's on the label on these drinks you buy? You don't know if it's actually in there. You don't know what's in that can.
Yeah. Any other supplements you recommend for people complaining about anxiety on TRT?
Yeah, I think magnesium and pregnanolone. I think that's this was covered, and it's even covered in a couple of books I have. But if I have a guy suffering from anxiety on testosterone, then yeah, I recommend high dose, like a gram or two of mag threonate, not threonate, because that's the one that crosses the blood-brain barrier, the blood-brain barrier, and it has the most anxiolytic effects. So yeah, I recommend magnesium threonate and pregnenolone for people who get a high anxiety.
Mm-hmm.
And believe it or not, that combination, I think Rob Kameneric mentioned that to me many years ago, one of the AMMG conferences, that the pregnenolone and the magnesium are ideal for people who get anxious on testosterone.
Mm-hmm. All right. And what about the CBD oil? Any experience with that?
CBD?
Yeah.
Yeah, I got a lot of experience with that. I mean, remember, I do medical cannabis in my
Yeah.
practice. Now,
But,
obviously, in medical cannabis, the people are after the THC benefits, the anxiolytic effects of the THC. But yeah, CBD in particular, I've got a lot of guys that swear by it. They'll do a CBD capsule, like a gel cap, before they work out, and they feel that they not only have more stamina, placebo effect, but definitely have the anti-inflammatory effect. They have less pain through the workout and after the workout when they're on CBD.
mm-hmm. But you don't use it for anxiety reasons.
Well, yeah, I mean, one of the qualifying symptoms for me to authorize cannabis for patients is anxiety. Back is
Ah, okay.
it's the second most common reason behind pain. But anxiety and depression, but primarily anxiety, is the number one reason I can authorize medical cannabis. But it's the THC, tetrahydrocannabinol, element in that plant that actually acts at the same receptors in the brain as does benzos. So I
Mm-hmm.
get people off the benzos all the time by just saying, "Hey, take this THC compound, and you'll be able to get off the benzo." And
Mm-hmm.
it's worked for everybody, or at least gotten them to take a lot less of the benzo.
I know a lot of doctors prescribing testosterone are getting their men of benzodiazepines, also SSRIs. We also talked about the useless statins. Are there any other medication you're looking for to get men off of them?
Benzos, opiates, primarily. That's why the state allowed me to do this, because of the opiate crisis. Um, well, that's primarily it. As far as the pain, I mean, if I can get them off, I mean, sleep. There's one. The men, insomnia, and they take sleeping medicines,
Yeah.
and those benzos, and things like, what's the one that people use out there, Ambien. Yeah, there's studies out now that the longer you're on those medicines, the greater your risk of dementia and Alzheimer's the longer you're on a benzo or Ambien. Yeah.
Yeah.
Those medicines are supposed to be used for a short period of time, not chronically.
Yeah. A lot of these men that really need testosterone are on an SSRI or a benzodiazepine. But what they really need is testosterone. And once they get onto TRT, they can really skip all or just get off all
Yeah,
the other medications.
yeah. No man should be placed on SSRI unless the doctor looks deeply into this testosterone profile first. Make sure the testosterone optimized.
Yeah, exactly. All right. I think we're through all the questions for the moment. Just a personal question. Do you still work out a lot, Jeffrey?
Of course, man. Do I brush my teeth in the morning? Hell yeah, every day. I work every day. I own my own gym. I'm in the gym every morning between 6 and 7. That's my hour.
Awesome.
I don't train like I used to. You know, I'm 70 years old, man. But you know, I train hard. You know, I'm 6'1", 205, but my body fat 6.5%. You know, I'm not a big guy like I used to be. But then again, like I got fake knees and fake shoulders. I got artificial joints. But yeah, I still work out. I work out every day, 7 days a week.
That's awesome, really. And you're still motivated to do so, or is it just discipline?
Well, I'm motivated to do so because it's my time. It's my time to recreate myself. I didn't say recreate. I said recreate myself. That's my time. I've earned that time. I take that time. There's no excuse. I own my own gym.
Rory Lodewijk, he says, my question, I saw that question, but that's really, a PED question, but maybe Dr. Ruterbusch is also very well known for his PED knowledge. So maybe just this one question, what muscle gains can a person expect while on TRT if they add 150 milligrams per week of Nandrolone or Trenbolone if training hard 5 days per week?
What can you expect? Yeah. With that regimen, significant gains, significant muscle accretion.
Yeah, but that's not something we could recommend on this channel.
No, but let me tell you something. I've been on that. I've been on a regimen for 20 years where I did Nandrolone and Trenbolone, and oh my gosh, you talking fantastic gains in a short period of time. It's almost scary.
Mm-hmm. But those gains, is that something you lose quickly once you get off of it?
Well, if you eat well and train hard and train smartly and don't overtrain, yeah, you will lose some of it, but you keep 50% of it.
Okay. If people want to work with you, Jeffrey, I know you're in our Facebook group still answering questions from time to time, but how can people work with you or contact you if necessary?
Well, you know, my wife's the boss of me. She runs my clinic, Kick Some Mass Wellness Center here in Great Orange Park, Florida, which is just outside Jacksonville. But you can get a hold of, you know, again, the website, Kick Some Mass. However, it's 3 S's because somebody stole our Kick Some Mass ID. So it's Kick Some Mass. So KickSomeMass.com.
I'll put the link in the description of this video.
All right.
All right. Now, so thank you so much for your time, Dr. Jeffrey Ruterbusch, and talk to you in the next one.
I appreciate this, given my 54 years experience. I just hope that some people, you know, even one person can pick up some little tidbit, some little nugget, and it pays off for them.
I'm sure someone will, and more than one is still looking. Already 298 views, so that's great.
All right, Steve. We'll enjoy this wonderful weekend. We're having wonderful 70-degree weather here right now. My favorite kind of weather out here.
All right, so enjoy.